My name is Binod Dhakal and I'm one of the assistant professor at the Medical College of Wisconsin. At this ASH, we're going to present data on multiple myeloma, patients with relapsed refractory multiple myeloma. It's a phase 1/2 study, combination of Bendamustine, Ixazomib and Dexamethasone. Multiple myeloma is an incurable malignancy despite the introduction of novel agents. Most of the patients ultimately relapse and need new therapies. So in this study, we decided to combine Bendamustine, which is a bifunctional alkylators and antimetabolites, with Ixazomib, which is a first oral proteasome inhibitor, with the Dexamethasone. So this is a phase 1/2 study. First aim was to understand the dose of the combination, and the patients that we included in this study were patients who were exposed to both immunomodulators and proteasome inhibitors and had to be refractory to one of those agents. And in the phase 2, we want to look at the overall response rate of the combination. We used 3 different dose levels of Bendamustine, 70, 80, and 90, with a fixed dose of Ixazomib at 4 mg on day 1, 8, and 15, with the Dexamethasone at 40 mg, and if the patients were less than 75 years of age, if more than 75 years of age, we use 20 mg of Dexamethasone. The maximum tolerated dose, or the recommended phase 2 dose, was dose level 2, that was 80 mg of Bendamustine on day 1 and 2, with Ixazomib 4 mg and Dexamethasone at 40 mg. And only 2 out of 6 patients at dose level 3 developed dose-limiting toxicities, which were mainly neutropenia and thrombocytopenia. Of 19 evaluable patients, the overall response rate of the combination at phase 2 was 61%. There were 11% of the patients had very good partial response, 50% had partial response, 40% had stable disease, and 2 had progressive disease. At median follow-up of 17 months, the median progression-free survival was 5.2 months, and the median overall survival was 23 months. Looking at the adverse events, the combination was pretty well tolerated, and majority of the adverse events were mainly hematologic, neutropenia, thrombocytopenia, and anemia. And in non-hematological toxicities, diarrhea and nausea were the main non-hematological toxicities. Peripheral neuropathy was present in 17% of the patients, and both were grade 1 and 2. So the study was pretty well. So this study showed the combination of Bendamustine, Ixazomib, and Dexamethasone as one of the combination that we could use for relapsed refractory multiple myeloma. Those patients were exposed to both immunomodulators and proteasome inhibitors and refractory to one of those agents. It was very well tolerated, and given the fact that it has very low rates of peripheral neuropathy and oral administration, this combination could be further explored in future studies.